As a healthcare provider, one of my primary goals is to prevent illness in my patients. In order to prevent illness, part of what I need to know is what they're at risk for. What we're talking about tonight is hereditary cancer syndromes. You and I and everyone in this room are born with the same genes. Our genes never change. Some of your genes are broken in a way that makes you look like you. Some of my genes are broken in a way that makes me look like me. We know that certain breaks on specific genes increased risk for specific illnesses. In the context of cancer, one break on a single gene can increase your risk for one or multiple cancers. When I'm able to identify what gene is broken, I am able to know what cancer my patients are at risk for and how high is the risk of developing that cancer or cancers. This allows me to take the appropriate measures to help keep them safe and prevent them from getting cancer in the first place. When I see a patient like Sean that's young and has a family history of a young breast cancer, I understand that she needs to be tested because there are things that I can do to help keep her safe from this point moving forward. We might do extra breast imaging like breast MRIs. We might even recommend a prophylactic bilateral mastectomy, which means removing all the breast tissue and having the breast reconstructed. I recommend hereditary cancer genetic testing to about 1 in 4 of my patients. Of those that I test, about 1 in 10 will come back with a positive genetic mutation. This means they have a gene broken in a specific place that I know increases their risk of cancer. They might be at risk for the cancer that is run in their family. Say they have a family history specifically of breast cancer. They might also be at risk for ovarian cancer, colon cancer, or multiple other cancers that they have no family history of. It's important for me to know exactly what they're at risk for so I know exactly how to take care of them moving forward. When I do genetic testing for my patients, there are 3 possibilities for results. One is that my patient has a genetic mutation and that's what's been causing the cancer in their family. Another is they have no mutation at all and everything looks great. The last is that they don't have a genetic mutation, but they do have an elevated risk of developing breast cancer in their lifetime. Regardless of what their result is, knowledge is power. And when I'm able to share that information with a patient and educate them about what they're at risk for, it lets my patients take their healthcare into their own hands.